Hi class, Dr. Lindner. Okay, this is a pretty long PowerPoint or PDF, I should say. So let's go through this. And it's not in, at least the blood vessel portion doesn't seem to be in extreme order. So we may be a little bit bouncing back and forth a little bit. I may pass through many of these slides because I have some other separate videos made on these. So when that point in time comes, I'll let you know. Okay. So this has 77 slides. I won't be going through all 77. So let's see how we do here. Okay. All right. So I have created a separate YouTube video for this that goes over the blood plaque. So make sure you review that. I have gone over these blood cells in a separate video, as well as the layers of a blood vessel. I have covered this in another video. So please make the time to find those. When I get to the heart, I'm going to pass through those as well because I have a separate video on the white heart and brown heart. Okay, so that being said, let's take a look. I'll refer to this as flat Stanley. So let's take a look at flat Stanley and see if there are some blood vessels here that we should know. So let's start with this arch of the aorta here. So when you start with the arch of the aorta, there are some blood vessels that come off of that you should be familiar with. Now, this is common carotid artery, but to be specific and earn full credit, you would refer to this as the left common carotid artery. Okay, this here is the left subclavian artery. Now, the third branch that's not listed would be right here. This red one going up and down, that would be the brachiocephalic trunk or the brachiocephalic artery, both acceptable answers. Okay, because there's only three main blood vessels that come off the arch of the aorta. On the right side of the body, it's the brachiocephalic artery or brachiocephalic trunk. Then on the left side, there are two, one being the left common carotid and the other being the left subclavian. Okay. All right, let's see what else we have here. Is there anything else posted on the arterial side? Yes. So the left common carotid, as we're coming up here, divides into a left internal carotid and a left external carotid. External stays externally and divides into some of these others. We could see this one maxillary artery going to the maxilla. We see a superficial temporal artery going to the temporal bone. Okay. And then we could see one going to the occiput. We call it the occipital artery. Let's look at some of the veins. This right here is the superior vena cava. What leads into it, if we start more externally, we have a left subclavian vein. There is a right subclavian vein. The right subclavian vein would lead into the right brachiocephalic vein. The left subclavian vein brings blood into the left brachiocephalic vein. And then the brachiocephalic vein brings blood into the superior vena cava, which brings blood into the right atrium. Okay, leading down into the brachiocephalic vein is an internal jugular vein. There is a right internal jugular vein and a left internal jugular vein. These jugulars would be analogous to the internal and external carotid arteries, right? There is no internal external carotid vein. Instead, there's an internal and external jugular vein. Okay. All right, let's take a look here. We're still on flat Stanley. Now, this one shows clearly the arch of the aorta. Here's the ascending aorta. So it goes ascending, arch, descending aorta. Okay. We can now see the three branches coming off of the arch of the aorta. There's the brachiocephalic trunk. That's on the right side. There's the left common carotid artery. And there is the left subclavian artery. Okay. Okay, now coming off of the heart here, we see this is the right ventricle. When the right ventricle contracts, it pushes blood through that pulmonary semilunar into the pulmonary trunk. The pulmonary trunk leads into the left pulmonary artery, and it leads into the right pulmonary artery. You can see a little bit right there. Okay, let's just see a tad bit right there. Okay, now let's take a look here. After blood is pumped into the left and right pulmonary arteries, the blood is in the lungs picking up oxygen, and it has to drive into the left pulmonary vein and the right pulmonary veins. Those are red because they carry oxygen. It's going to drive the oxygenated blood into the left atrium. Okay, whereas the right brachiocephalic vein and the left brachiocephalic vein are going to bring deoxygenated blood into the superior vena cava, which leads deoxygenated blood into the right atrium. Underneath the diaphragm, which is right here, we see this blue vessel coming up, which also leads into the right atrium. That's the inferior vena cava. So the superior vena cava and inferior vena cava, and right here, the orifice to the coronary sinus bring deoxygenated blood into the right atrium. All right, now, so here's the diaphragm. Here's the abdominal aorta. Let's take a look at some of the vessels coming off of that. A biggie is the celiac trunk. And what comes up off the celiac trunk is going to be the left gastric artery, right there. The splenic artery, going to the spleen, and the common hepatic artery. Okay, those are the three arteries that make up the celiac trunk. Okay, then we continue down, and right here, right there, is a superior mesenteric artery, and then down a little bit further is the inferior mesenteric artery. Superior mesenteric is going to go to like the small intestines, the ascending colon or the right colic area, the right colic flexure or the hepatic flexure, and about half of the transverse colon. That's all superior mesenteric. And then the other half of the transverse colon, descending colon, sigmoid colon, that's going to be blood vessels coming off the inferior mesenteric. And then we have these whiskers here. This is the left gonadal artery. And then there's a right gonadal artery as well. The gonadal arteries will either be testicular or ovary, going to the testicles or to the ovary. All right, so again, main vessels coming off the abdominal aorta. Make sure you know the celiac trunk, superior mesenteric, inferior mesenteric, gonadals. Going to the kidneys, easy enough. There's a right renal artery, and there will be a left renal artery. This is the abdominal aorta. From the abdominal aorta, ooh, looks like I missed one here, up in the liver. So these are kind of straightforward, right? So if you see blood vessels here going more distally in, that's the hepatic artery proper. I don't know if I'm going to hold you responsible for that one. I'm more interested in you knowing the common hepatic artery first, okay? I don't want you confusing this one with the hepatic artery proper. So I'll be happy with the common hepatic artery here, okay? But when it's actually in the lobes of the liver, they call it the hepatic artery proper, FYI. All right, let's look at the abdominal aorta. You'll see that there's a fork in the road. It bifurcates right here and here. These are called the common iliacs. Again, anything with the word common in it, we know is going to divide into a right and left, internal and external something. So the common iliacs will divide into a right external iliac artery and then a right internal iliac artery. Right, the same thing happens on the left-hand side. Okay, here is the flat Stanley again. So this was more arterial. Let's look at some of the veins here. Going to the kidneys, we'll knock those off first. Those are the renal veins. This is a real important one called the hepatic portal vein. The hepatic portal vein are blood vessels. These are veins that are coming from the spleen, coming from the superior mesenteric, coming from the inferior mesenteric, coming from the gallbladder, right? All of these, all of the deoxygenated blood and nutrients from the GI tract don't go right to the inferior vena cava, right? Like all of your muscles are going to bring blood in through the internal and external iliac veins up into the inferior vena cava, and then it can go into the right atrium from the inferior vena cava. Our nutrients from the GI tract and that blood from the GI tract needs to be filtered. So when it needs to be filtered, it's going to go into the hepatic portal vein, into the liver, and then from the liver, there are hepatic veins. The hepatic veins will now divert the blood back into the inferior vena cava. So hepatic portal brings the blood into the liver to be filtered. And then from the liver, there are hepatic veins leading into the inferior vena cava. Now it's ready to be shipped to the right atrium. Here's the inferior vena cava. There was an internal and external iliac vein. There was a common iliac vein, artery, I should say. Let me get this straight. So on the arterial side here, there were right and left common iliac arteries. There are right and left iliac veins. Here, there were right and left external iliac arteries, and right and left internal iliac arteries. We have the same thing on the venous side. This shows the right internal iliac vein. Here's the left internal iliac vein. Here's the right external iliac vein. And here's the left external iliac vein. Okay, let's look still on flat Stanley here, right? It's not kind of going in any major order, but it's okay. It helps us think and helps our thoughts go to different regions. So here's the ascending aorta, arch of the aorta. We see the branch coming off here, the brachiocephalic. The brachiocephalic is going to have a right common carotid artery and it's going to have a right subclavian artery. The right subclavian, when it's in the armpit, right around here, it's called the axillary artery. That's really in the axilla. When it's in the mid-arm, it's called the brachial artery. The brachial artery, this is where we end up taking blood pressure when the stethoscope goes in the cubital fossa. We're listening to the brachial artery. Then there is a radial artery that follows the radial bone, and there's an ulnar artery that follows more on the ulnar side. In the palm of the hand, there's a palmar arch, and there's one superficial and one deep. And then going to the digits, we have digital artery. Okay. On the venous side, here's the superior vena cava. We have a right brachiocephalic vein here. There's a subclavian vein. And in the armpit, there's an axillary vein. So remember, when we do venous return of blood, it's everything starting at the fingertips and it's moving up in this direction. When we talk about the arterial side, we start at the heart and we work our way distally. When you do the veins, you think distally, and how does blood move more proximally? Okay. So in the armpit was the axillary vein. And then we move on down. We move on down here. Now, what you'll notice is that there are two veins that we haven't heard of before because there are no analogous arteries that reflect that. On the lateral side, it's the cephalic, and on the medial side, it's the basilic. So everywhere on the medial arm, all the way down to the medial forearm, and on the lateral medial arm to medial forearm is basilic. Lateral arm, lateral forearm, that's going to be the cephalic vein. Okay. There is palmar arch veins. And again, you have digital veins on this one. Let's look at the lower half of flat Stanley. Let's look at the arterial side. So right here is the left external iliac artery. That from that left external iliac artery is the left femoral artery. The left femoral artery is going to come down like this, and it's going to go behind the knee. If you look at the orientation of this foot, the toes are here. So this is anterior, this is posterior. So the femoral artery goes here in that popliteal fossa, the depression behind the knee. That's the popliteal artery. The popliteal artery is going to go down to the posterior calf, and it's called the posterior tibial artery. There is a branch that comes off of this as well that's called the anterior tibial artery. The anterior tibial artery is off of the popliteal. It goes between the tibia and the fibula, so you can see it here on the anterior side a lot better. Okay, right here. And on the anterior side, we also have the dorsal pedal artery that can be palpated between that first and second digit on the dorsal surface of the foot. Okay, and then the plantar tibial goes underneath the foot and becomes the plantar artery. Here on the right hand, on the right, our reading left, but the individual's right hand side is the right femoral vein. Now, if you look at this moving down, there is a very apparent blood vessel that comes off of that femoral vein, and it's called the Greater Saphenous. It's saphenous means very apparent. So the Greater Saphenous is from up here comes all the way down, medial thigh, medial leg, all the way down. On the lateral side of the leg, there's the lesser saphenous vein. So there's a greater saphenous vein and a lesser saphenous vein. Okay, let's see what else we have. So here is the crystal skull. This is primarily to look at the Circle of Willis. We can see going through the cervical spine, through the transverse processes, there is a foramen through the TPs, and that's called the transverse foramen. And through the transverse foramen of C1 to C6, the vertebral artery travels. So here's the occiput, here are the eyes, here's the nose. So this is the left vertebral artery. This is the left common carotid. Whenever there's a common, it's safe to assume it will divide into a left internal carotid and a left external carotid. From that external, we could see the occipital artery here. And from that external, we see the left superficial temporal artery. Okay. When we take off the top of the skull, remove it, remove the brain, and look down, right here is the magnum foramen. And what we see coming through the magnum foramen, we see the left and right vertebral arteries. Those vertebrals come together, become the basilar artery. And from that basilar artery, right here is the Circle of Willis. Now we have to find an anterior cerebral, a middle cerebral, and a posterior cerebral. So I'm going to show you the cerebral artery that goes to the front, the middle, and the back. So here is the posterior cerebral, this one, and this one. Then we have a middle cerebral, the large, thick one, this one, and this one. And we have an anterior cerebral here. All of this is anterior cerebral, and this is anterior cerebral. Okay, so let's review. We have a right and left vertebral artery, a basilar artery. We have a right and left posterior cerebral. We have a left and right middle cerebral. We have a left and right anterior cerebral artery. The only two left are the communicating arteries. There's one in the front, one in the back. Here's the posterior communicating artery. That's the right posterior communicating, left posterior communicating. And then there's an anterior communicating. That's the bridge connecting the two anterior cerebrals. Okay. And these little itsy bitsy smaller ones, these are called cerebellar arteries. Don't confuse cerebellar with cerebral. Cerebellar goes to the cerebellum. Cerebral goes to the cerebrum. Okay. And hard to tell, but right here would be where the internal carotids come in together and join, right? Because the vertebral arteries and the internal carotids both come in into the brain for that Circle of Willis. From the posterior side, you can see the vertebral arteries going through here. Now here's the venous side. So we have the superior sagittal sinus. We have a transverse sinus, and we have the confluence of sinuses right here. Again, you can see the Circle of Willis, but then we can see the transverse sinus, the confluence of sinus. This is like the bird's eye view looking down. Here's the sigmoid sinus. And all of this is going to end up draining eventually into the right and left internal jugular. And the internal jugular is going to come down and find its way into the right and left brachiocephalic vein. The brachiocephalic leads into the superior vena cava. Right here in the center is the occipital sinus. Okay, where did this come from? So this is the diaphragm. but we're looking at the diaphragm from underneath. So because we're looking at it from underneath, this is the esophageal hiatus here. We see an artery and a vein because it's underneath. It's the inferior phrenic artery and the inferior phrenic vein. If we're looking at it from the other side, from the superior view, then we could see the superior phrenic artery. This is the phrenic nerve, but it's not showing the superior phrenic artery here. Just another model showing the Circle of Willis again. So we have vertebral arteries coming in, the vertebrals come in, they unite, form the basilar, and after the basilar, we have the posterior cerebral, we have an anterior cerebral. This one here is really not showing the middle cerebral too well, so it can't be asked here, but it is showing the right internal carotid and the left internal carotid. It's cut, but it's here and here. The anterior cerebrals, and then connecting them is the anterior communicating. And on the posterior side, here's the posterior communicating. We have these cerebellar arteries leading to the cerebellum. When someone has a stroke, depending on what type of functional loss there is, it can indicate where the lack of oxygen and glucose is, where you have dying neurons. So if the person is having difficulty speaking, we know it's on the left-hand side, affecting Broca's area, the motor area for speech. And then they'll have hemiparesis on the right-hand side of the body. Okay. If there are balance issues, then we know it's one of the cerebellar arteries. Okay. Okay, let's see what we have here. Here's the occipital sinus. Here's the transverse sinus. Here's the confluence of sinuses. Here's the sigmoid sinus. And that's going to lead down into the internal jugular vein. This is just the skull, part of the skull that's removed. I probably won't ask anything here. Yeah, I won't ask anything from this view. It's a little bit difficult. Okay, we've seen this board before with endocrinology. They're showing it again just because it shows the heart and shows a few key vessels here, like the arch of the aorta. Here is the right. Let's see if we could find this. Where's 27? Trying to find. Okay, it looks like it's not here. I don't see the brachiocephalic on the right. It's kind of being a little bit blocked and obstructed, but it is showing the right common carotid up here. I don't think they labeled the other. So let me see what else. Okay, let's look right here. This right here is the superior vena cava. So then we have the left brachiocephalic vein, right brachiocephalic vein leading into it. Here's the right internal jugular vein. And then lateral to that is the right external jugular vein. Same thing on the left side, left internal jugular vein, left external jugular vein. Just adjacent to that, we have the left vertebral artery and the right vertebral artery. Right here, coming across this way, this is the left subclavian artery. Coming across, looks like this way, right in here. This is the right subclavian artery. Okay. Off the subclavian is where we have the vertebrals. Let's see, coming off of here, this is the abdominal aorta. we're going to have a renal artery on the right side. Here's the right renal artery, right renal vein. Here is the left renal vein going to the kidney, number 30. Coming down, the abdominal aorta then bifurcates into a left common iliac artery and vein and a right common iliac artery and vein. Okay, so it's kind of nice when you see things scattered all around here. You can kind of still talk yourself through it. The liver would be here, so it's not showing the hepatic portal vein, but it is showing the hepatic veins. These would go from the liver to the inferior vena cava, which is this, inferior vena cava. Okay, looking at the lateral head here, right? It's going all over the place, but it's okay. Here's the Scm Sternocleidomastoid muscle. So superficial to that, since the individual, we're looking at the right side of their face, it's the right external jugular vein. And then more internally coming up here that we see going up past the parotid, that's the right internal jugular vein. Let's see, what else back here? Occipital artery. And this is important, the superficial temporal artery and temporal vein. These are important in smokers. There's a condition called temporal arteritis. It can lead to blindness. So oftentimes we take eye pain and pain around the temporal area pretty seriously. Okay, let's see what else. Right here, you can see just a little bit of the right common carotid. So as it moves up, it'll divide into an internal and external. Just can't see it from there. Looking at the inside of the skull, here's the artery leading into the brain. So this is just showing the basilar. What's coming up, that would be just before the basilar. As it comes up, that's the vertebral. It's not labeled, but that just functionally speaking, it's vertebral, then it's the basilar. Okay. Okay, now here's the zygomatic arch. Here's the teeth. So we're looking at the left-hand side of the individual. So right here is, let's start from left subclavian vein. Here is the internal jugular. This is the internal jugular. Right here is the left common carotid. The left common carotid is going to bifurcate into a left external carotid artery and a left internal carotid artery. Okay. Okay, let's see what I'd like for you to know here. Okay, nothing, we've already covered most of this, but the others I'm not going to hold you accountable for. We've already done the heart. We've done this white heart already. Let's take a look at the extremities and see what arteries we can see here. This is the left leg, right? Here's the left psoas major, the left iliacus. So right here is the left common iliac that will divide into a left external iliac and a left internal iliac. Under the inguinal ligament, this is the inguinal ligament going from the ASIS to the pubic tubercle, we have the femoral artery. And this is the femoral artery, this is the femoral vein, this is the femoral nerve. And then right there off the femoral artery is the beginning of the Greater Saphenous vein. So here's a close-up, here's the inguinal ligament. Here is the external iliac vein. Here is the external iliac artery. Once we are below the inguinal ligament, it is the femoral Artery, and Femoral Vein. Off the Femoral Vein, right there, is the Greater Saphenous Vein. Remember, the lesser saphenous or small saphenous is down in the leg. Now, this is the posterior, what are we looking at? The posterior view of the thigh. So this is the sciatic nerve. Sciatic nerve bifurcates and splits. So right in the back of the knee, in that popliteal fossa, is the popliteal artery. Okay. Not going to hold you responsible. Geniculate means knee. I'm not going to hold you responsible for the medial and lateral, superior or medial and lateral inferior geniculates, but you can see they're just these branches that come off of it in the popliteal fossa. Just know the popliteal artery coming down through there. This is the anterior leg. So this right here is the anterior tibial artery, and that's going to come from this popliteal as we come down. So the anterior tibial comes down through between the tibia and the fibula to the anterior portion. Here's the posterior tibial artery. The posterior, let me go back here. I think I may have messed something up. So the popliteal artery comes down and becomes the posterior tibial artery. Now, from the posterior tibial artery, there is a branch that becomes the anterior tibial. That's going to kind of penetrate between the tibia and the fibula and go anterior to become this. Okay, so let's go through that again. Here's the popliteal artery, posterior side, behind the knee. The popliteal artery continues down and becomes the posterior tibial in the lower leg. From the posterior tibial, there's an anterior tibial artery and a fibular artery that come off of it. Anterior tibia is up higher, fibular is a little bit lower. Anterior tibial penetrates between the tibia and the fibula, but goes anterior, whereas the fibular artery just comes down and stays lateral. Okay, here's just another model showing the upper thigh. And here we could see the femoral artery, femoral vein, femoral nerve. Again, looking behind the knee, this is just a different model. Here's the popliteal artery. And now this one shows what I was trying to explain before, where the popliteal artery continues down to the posterior leg and forms the posterior tibial. And now from the posterior tibial, here's where the anterior tibial comes off of it, penetrating to the front of the leg. When it penetrates to the front of the leg, you can see it continuing here as anterior tibial. Pretty neat. Okay, here's the liver. Here is the inferior vena cava penetrating through, and this is the left hepatic vein. Remember, through the liver, you have the hepatic portal circulation that leads into the liver after it's filtered. How does that filtered deoxygenated blood get into the inferior vena cava to get back into the right atrium? It's got to get into the hepatic vein. So this is the left hepatic vein. This is the right hepatic vein. Here's the inferior vena cava. When we turn the liver around, now you could see this purple structure. The purple structure is the hepatic portal vein, right? So the hepatic portal vein, that's where the splenic is coming into. That's where the superior and inferior mesenterics are coming into. That's where a lot of, from the gallbladder, the intestines, they all kind of come into this hepatic portal. It filters it out and then finds its way into the hepatic veins. The hepatic veins will bring it into the inferior vena cava. Okay, this is the green is the gallbladder. The gallbladder has a cystic artery and a cystic vein. Okay, don't worry about the hepatic artery proper. Don't worry about that for now. Here in the lungs, it's a nice model. We use it for respiration, but it also overlaps to the blood vessels because you can clearly see the ascending aorta. You can see the three branches off of it: brachiocephalic trunk, left common carotid, and the left subclavian. From the brachiocephalic trunk forms the right subclavian artery and the right common carotid. Leading into the lungs, we could see the pulmonary artery. You can also see the pulmonary veins, which are red. Here's the thoracic aorta. Here's the diaphragm. Under the diaphragm, that first blood vessel right under the diaphragm is the celiac trunk. And that's off the abdominal aorta. Celiac trunk has those three blood vessels coming off of it. You can't see it here, but it's the left gastric artery, the splenic artery, and the common hepatic artery. Okay, here we're looking at some of the veins. So here's the superior vena cava. Both right and left brachiocephalic veins lead into it. And then both right and left subclavian vein and right and left internal jugular veins will lead into eventually the superior vena cava. So here's the right subclavian and here's the left subclavian. Here's the right internal jugular, here's the left internal jugular vein. Here's the left and right pulmonary veins. Remember, the veins are red. They're carrying oxygenated blood back to the heart. Here's the inferior vena cava underneath the diaphragm, and the hepatic veins lead right into the IVC. So remember, hepatic portal vein leads into the liver. The liver does its cleansing and detoxification, then has to find a way to bring that blood back to the inferior vena cava, and it does so using the hepatic veins. Okay, here is the pancreas, the duodenum, the kidney, the adrenals. So let's see what we have coming off of here that I'd like for you to know. Here's the spleen. So we have the splenic artery. These are the adrenal glands. So adrenal artery and adrenal vein, no big deal. Let's see what else I want you to know here. Off of the splenic artery, nope, that's it. From this one, that's it. Let's see if we can flip this around, and we can. So now what we're looking at here is the same model, but from more of the top view. And because we're looking at it from the top view, we can see not just the front, but we can see what's sneaking on here in the backhand side. So here's the hepatic portal vein. That's the purple one. That's the hepatic portal. Right here is the celiac trunk. Now from the celiac trunk, there's the left gastric artery that's coming up above right here. There's the common hepatic artery right here. And then there's the splenic artery going to the spleen. So the celiac trunk has what three blood vessels? Left gastric, common hepatic, and splenic. Okay. Now let's see. Now we're looking at it from the posterior. So you can see the celiac trunk right here. The left gastric looks like it's broken. I could see an orifice for it, but it looks like it was broken. Here's the splenic artery going to the spleen. Here's the renal artery, renal vein, hepatic portal vein, and that's all I want you to know from that. Same picture. Let's see. What do I want you to see from here? Let me see if there's anything. Splenic artery. Here's the left gastric. And that's about it. This right here is the superior mesenteric. It's just important to know functionally the superior mesenteric is going to go to the beginning of the intestines, and this is the duodenum. It's going to go to the small intestine, the duodenum, jejunum, the ileum, the ascending colon, or the right colic portion, and a little bit of half of the transverse colon, but not too much. Here's the left gastric artery. Here's the splenic artery. And here's the common hepatic artery. Those are the three that come off of the celiac trunk. Okay. Here's the hepatic portal vein. The hepatic portal vein has contributions from the splenic vein, the inferior mesenteric vein, superior mesenteric vein. Those all lead into the hepatic portal, right? Because it's bringing all the nutrients and blood from pretty much the entire GI tract. Here is the stomach. We're looking at the lesser curvature of the stomach, and this is where the left gastric artery and the right gastric artery come together to complete the circulation on the lesser curvature side. This is just another view of the stomach showing left gastric and right gastric coming together to bring oxygen and nutrients to the lesser curvature of the stomach. This is the greater curvature of the stomach, which gets a different blood supply. I'm not going to hold you accountable for that one. Okay, let's see. Is there anything I want you to know here? Now I'm going to skip this one. This one a little bit. Let's see if I can blow this up a little bit. Here's the celiac trunk. So you can see the left gastric artery here. You can see the splenic artery here. And then we can see the common hepatic artery. Those are the three off the celiac trunk. Then there's a superior mesenteric, an inferior mesenteric artery. Those are off the abdominal aorta. And I don't see the gonadals very well. It looks like there's an arrow pointing to the left gonadal artery and vein and the right gonadal artery and right gonadal vein. Let's see what else I wanted you to see here. Off the abdominal aorta, we can see the common iliac artery on the right and the left common iliac artery. We can see the right external iliac artery and the left internal iliac artery. Okay. Again, just, you know, the blood vessels are the blood vessels. Doesn't matter where we're looking at, right? Let's see. I'm going to skip this one. I think I'll skip this one. Okay, this is an important one. This is the lungs are removed so we could see the posterior thorax here. And you need to know the azygous vein right here, the hemiazygous azygous vein here, and the accessory hemizygous, right? So it's this and this right here. This, and this kind of crosses over like this. So we have the azygous, the hemiazygous, and the accessory hemiazygous. Okay, and these are all involved in draining the blood vessels from the ribs and the intercostals. Let's see here. So here are the intercostal arteries, the intercostal veins. Here's the inferior vena cava. Here's the abdominal aorta, left common iliac artery and vein, left internal iliac artery, left external iliac artery and vein. Don't worry about this one. Here is the right external iliac artery and vein. Here's the left common iliac artery and vein. Here's the left internal iliac artery, right? External is larger here, and then the internals move inward. Here's the left femoral artery. Here's the right femoral artery. And here's the right femoral vein with the Greater Saphenous vein that comes right off of it. Anything up here? Let's see. We're getting close to the end. Nah, there's better. The only thing is maybe this left internal jugular vein. That's important. Okay, left common carotid. And then the common divides into a left external and a left internal. Okay. Right here, following the sternocleidomastoid, that's the left external jugular vein. The external is going to lead right into this subclavian, which leads into the right brachiocephalic, which leads into the superior vena cava. And those are labeled here. So here's the right external jugular vein. Here's the right subclavian vein, the right brachiocephalic vein, and the inferior vena cava, right? So blood is going to be moving in this direction, or in this direction. Or left internal jugular vein. Here's the left subclavian vein. Here's the left brachiocephalic vein. Let's see what else. Pulmonary veins, pulmonary arteries, thoracic aorta. That's it. That's all I'd like to show you from here. Here's the diaphragm. Here's the abdominal aorta. So we can see the celiac trunk. We could see the superior mesenteric and the inferior mesenteric. And then we can see the gonadal arteries. Okay. We could see the left renal artery and left renal vein. And then going to the lumbar vertebrae, we have the lumbar arteries and veins. Okay. Here's the right renal artery and right renal vein. Here's the inferior vena cava. Here's the right external iliac. Here's the left internal iliac. Let's see, nothing from here, blah, 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 nah, and nothing from here. Okay, That pretty much covers most of those models in very crazy sporadic order, but it helps you, think on the spot.